A significant number of our patients have already been reviewed much earlier in the year.
If you're thinking about a different way of approaching your chronic disease management, then they are just a fantastic solution. One of the biggest issues we had, which I think an awful lot of practices have had as well, is around capacity. So how to get the work done for chronic disease management, but also how to deal with the acute work. We chose Suvera because they were doing something that seemed to be pretty unique.
When we first met with the team, we found them very engaging, very enthusiastic, very aligned with our own ideas. They offered something slightly different. From our first meeting, we saw the potential that we could gain from working with them, supporting our practices and bringing in some additional staff remotely that we weren't able to achieve through our local recruitment processes.
Working with Suvera will enable patients to take more responsibility for their own health. They'll be putting their own blood pressures, their weight, their height, etc. into the online system. So they'll be seeing those numbers. And by seeing those numbers, they'll know what numbers they should be aiming for. Maybe they'll start working actively towards that and really taking responsibility for their own health.
Now that we have the Suvera pharmacists and the team working with us, we have definitely seen a reduction in workload in the practices.
It means that we have more capacity to deal with other things, so to perhaps deal with the acute workload, but also maybe even just to give people a little bit of headspace. Maybe just to allow a GP to have a lunch break, which is something that's really rare, let me tell you.
It's reducing our GP workload, reducing the burden on our nurses in terms of supporting with the long-term conditions work, just taking out some of the maybe some of the easier patients and just sort of getting that workload done and out of the way, getting our QOF work done quicker earlier in the year so we don't have to have that end of year panic that we normally do.
One of the benefits of working with Suvera that I hadn't really appreciated until we started working with them was that there's a benefit not just for the clinical team but also for the reception and admin team as well. So chronic disease management means that a letter or a text has to be sent out to someone has to do that. A phone call has to be taken to book the appointment, someone has to do that. The fact that Suvera do all of that for you means that your staff don't have to.
A significant number of our patients have already been reviewed much earlier in the year than they would have been done. This is particularly beneficial to those patients that are higher risk, that we might have just focused on a birthday recall, which may not have been for 6 or 9 more months, and they've been now reviewed and treated much earlier.
By getting all of our chronic disease management done by Suvera early on in the year, we've got people as healthy as we possibly can in the lead up to winter, which of course is one of our peak times. So we're able to see really easily whose blood pressure is coming down and whether someone who started out at stage 3 hypertension is now down in normotensive range. That's brilliant for them because obviously that reduces their risk. It's also really helpful for us from a QOF management point of view because we can then rerun our searches and we can see that actually in the last month we've achieved, I don't know, perhaps a couple of hundred extra hypertension reviews than we thought we did because Suvera have done them.
Suvera onboarding experience has been great, really, from start to finish. They met with us as a PCN management team and provided all the information we needed to go to the board and provide the practices with the information about the whole concept and what was going to happen. I would have no hesitation recommending Suvera to other practices and PCNs.
They're a great team, they're really friendly, they're really approachable. And if you're thinking about a different way of approaching your chronic disease management, then they are just a fantastic solution.